Welcome to the HCC Respiratory Care Information Session. This session is a mandatory requirement for admission to the program. In a few minutes, I will talk about how the program admits students. But first, let me give you a little bit of background on the program. In 1998, it was decided that Hillsborough Community College was going to start a respiratory program to be able to furnish the hospitals in the area with enough staffing and respiratory therapists. It's been accredited by COARC, and I'll talk about COARC later on, but that is the Commission on Accreditation for Respiratory Care. First of all, I want to previously introduce myself. My name is Gina Ricard, and I am the Program Director for the Respiratory Program here at Hillsborough Community College. Scott Miller will be talking to you shortly, and he is the Director of Clinical Education. And between the two of us, we'll give you most of the information that you will require in order to make a decision of whether or not you want to put in an application toward the respiratory program. So first, let me give you an overview of the skills that is necessary to become a respiratory therapist. Quite often, people don't really know what a respiratory therapist is. Hopefully, you've done your due diligence and done a Google search to find out what respiratory therapy is and what respiratory therapists do. But quite often, what we're involved in is the care of the airway, as well as the cardiopulmonary diagnostics and treatments that might be needed for patients in the hospital. Sometimes it can be small things, just making sure patients are expanding their lungs well after they have surgery. And other times it could be a little bit more involved, taking care of highly sophisticated equipment like ventilators. We encompass all different parts of the hospital, from the emergency room. For every trauma and code that comes in, it's a respiratory therapist who responds. We draw blood on patients to see how their heart and lungs are functioning. We also handle all different age groups, from pediatrics and infants, the premature babies who are born. There's a respiratory therapist there at every delivery of a premature baby, up through geriatrics and then some, 100-year-old patients I've taken care of. So we run the gamut, and we travel a lot of different places in the hospital and quite often walk far distances. There are many different areas of respiratory, however. Some people do patient diagnostics for pulmonary diseases. So you can work in a pulmonary function lab. You can work in a pulmonary rehabilitation clinic that helps people who may have had COVID or chronic obstructive lung disease get back on their feet and have better endurance. We can't make diseases go away, but we can sometimes help patients find better ways of living with their disease. So there are many different types of respiratory therapists. Most have a basic training of 2 years at a program such as ours, and then later on can go and even specialize more and get advanced credentials. I will cover credentials later on in one of the subsequent videos. So we walk long distances. We have to think on our feet. We have to critically think, and Scott's going to discuss critical thinking skills later on. And those are just a few of the things that we do. You can work in sales. You can work I mentioned the diagnostic labs. I mentioned the rehabilitation areas. You can work in acute care facilities such as Tampa General or St. Joseph's Hospital. You can also work in smaller acute care facilities, such as some of the area hospitals, such as like Wesley Chapel, Advent Health, or another one is it's called Baycare Wesley Chapel, or you can work at Brandon Hospital. There's many different hospitals in this area, big and small, but there's also some that are called long-term acute care facilities. So those would be like a Connerton or a Kindred that handles patients for a certain length of time and then have to get discharged to either the home or back to another facility. But they're not severe enough to still stay in the hospital. It's usually a transition phase, sort of like a rehabilitation. So you can also work in a lot of different other facilities. You can be a case manager and help patients get discharged from a hospital and help plan their care, because from day one, what the hospital is looking for is, when is this patient going to go home? I also worked in home care, and home care is a facility that you actually go to the patient's home and help them through a lot of different things, usually teach equipment primarily, but we're trying to change that to make sure respiratory therapists can help clinically in the home also. So that's just a few of the different examples. If you go to the website called BNRT, Just search for that, Google online. It'll also give you a lot of different ideas and a much more background than I can give in this video to help you figure out if respiratory therapy is a career for you. So one of the first things that you need to do to apply is to apply to HCC itself. So most of you have probably already done that and have a Hawkmail email as well as access to that you were already accepted at the college. It's free of charge, so there's no cost involved at all. And then they'll have you make sure you get your transcripts from any other, either your high school or any other colleges that you actually send in, and they can evaluate those. There is if you go to the HCC website, you can go through and find out how to apply to HCC. Once you're accepted, that's when and you finish your prerequisite courses that I'll cover in a few minutes. Then you can turn around and go to putting in an application. So if you search for health sciences on the HCC website, it'll take you to a page that you can find the application. The application is only a 2 or 3 page online form, very quick and easy to do. But you'll have to make sure that you've completed this information session before you fill out that application, because you need the checklist that we're going to send you verifying that you've attended this information session. And as I said, there's going to be 3 videos involved and some questions after you do each video. So a copy of this signed checklist must be included and uploaded with your application. You can also talk about some of the prerequisite courses that you're going to need. So the first one is English 1101. It's a very common course that I think most people have taken during their college career. You also need the math course, College Algebra, which is referred to as MAC 1105. You need Anatomy and Physiology 1, which is BCS 2085. You need the lab that goes along with AMP 1, and that is BCS 2085L. You need Anatomy and Physiology 2, which is BCS 2086. You need Anatomy and Physiology 2 with the lab, the lab, BCS 2086L. You need Microbiology and Human Disease, which is MCB 2000. The lab going with that is MCB 2000L. And you also need to have either POS 2041 or AMH 2020, which is the civics literacy that is required by state law. So those courses, we determine your GPA on those courses. So it's very important that you score good scores on that so you can have at least a 3.0 GPA. Now, that's not the lowest we'll take. We will take as low as a 2.0, but your chances are better the closer you are to 3.0 or above. We've taken as low as 2.0 or 2.2, but quite often you're up against whatever other group of students who are applying at the same time you are. We do not have a waiting list. We do have an alternate list, so if someone does not attend orientation, you may be called to step into a spot for the class. And we take 32 students every cohort. So that is that in a nutshell. But you are ranked on your GPA on the prerequisite courses only. Your overall GPA for your college level courses will only play into a tie. So if you were the last person being accepted and you and someone else are tied for your GPA, they'll look to the overall GPA to figure out who has the higher overall GPA, and that is how they proceed. If you are admitted to the program, you will receive a letter first from admissions letting you know that you have either gotten a spot in the group or that you're an alternate. You must respond to that email and do exactly what that email says. So it's only going to be sent to your Hawkmail email. They will not send you anything through regular postal mail. They will not call you on the phone to hound you. And you only have probably about 48 hours to respond. So it's because then they're going to go to the next person on the list if you don't respond. You can't accept something from a different program. That's totally fine and say, I don't need my seat. Or if you did accept another program, but you really wanted respiratory instead, you can tell them when you contact admissions to accept, say, I'm going to be in the respiratory program. I would like to resign my seat in whatever other program you already accepted. That's totally fine. And it happens quite often. Do not contact admissions directly. They will not be like sending out, oh yeah, we're going to decide in a few weeks. It's about 6 weeks after May 15th that they will send you out an email. However, that being said, sometimes the process goes more smoother than others. So they might want to reach out to you earlier. I would definitely be checking after the 3-week mark. I'd make sure every single day I check my Hawkmail email to see if anybody has contacted me from admissions. Because sometimes there's a question that comes up. So I would always be contacting and making sure every morning I check my email, because you do have a little bit of a window, but it's not a large window. One thing I need to make sure I cover on your math and science courses, they must have been taken within the past 7 years. So whatever year that you're watching this, the past 7 years from this, that's when you have to take the course. And you can always ask admissions to verify, but that's the case. Not the English courses, not the civics literacy courses, neither one of those. It's only your math and science courses. Now, there's a lot of different jobs I mentioned already that you can do, and a lot of different concentrations. Once you become a respiratory therapist, there's a process that I'll tell about in a future video, but you can actually centralize and do neonatal intensive care unit. You can do pediatrics. You can do primarily adults. You can do pulmonary function testing. There's some credentials that you can get extra, so you take an extra test and you're able to put more letters after your name. I've taken 2 additional credentialing exams, so I have a lot of it. I have the little alphabet soup after my name, but it's just so you can challenge yourself to go on, so you have the specialty credential. If you have any questions about your previous coursework, or if things will be accepted to HCC by a different college that you're coming into HCC to transfer them, I would recommend contacting our health science advisors. Now, I'm not going to give you the names here because they can change at any time, but if you want to email somebody, you're going to email HWST advising, all one word, HWST advising at hccfl.edu.